Okay, so like we mentioned, we're going to be talking about so many things. We're going to go through overuse injuries, which I'm sure has happened to many of you out there. So let's first talk about what they are and why they're so common. Define it for me, if you will.
So overuse injuries, I would define more as like a training error. It's usually something that occurs when you've started either a new routine, you've increased your regular routine, and then that leads to a breakdown of either soft tissue or bone in the various areas, either shoulder, knee, etc.
Okay, but I'm going to be the devil's advocate here.
Yeah.
Can it also happen to people that just have a predisposition to getting injured? Like I have a friend of mine, she's always injured and she does everything right. So can there be something in the genetics?
There could be a genetic component to certain aspects of this, but usually there's got to be some underlying pathology. So either that, depending on what her issue is, if she has, if she's poor flexibility,
exactly,
she needs to correct certain things before she can do her activity.
Something else that I note that happens is in the new year. People get really gung-ho about, this is the year, 2019, I'm going to lose weight, I'm going to do weights, I'm going to run.
Yeah.
And the next thing you know,
that's exactly what happens. Usually it's when they go 0 to 100. It's
like getting a Toyota and then a Ferrari.
Yeah, you need to work your way up to that level. So usually that's one of the reasons I wanted to do this topic is now that we started the new year and there's a lot of people doing their new workout, the new routine, it can lead to some of these injuries, and I want to try to prevent that before it gets more serious.